Have you ever been told that you are hypermobile but not entirely sure as to what that actually means? I want to break it down for you. I want to talk you through what that actually means. So let's start by chatting about hypermobile spectrum disorders versus hypermobile Ehlers-Danlos syndrome and other types of Ehlers-Danlos syndrome or EDS. I want to start by saying that HSD, hypermobile spectrum disorders, and H or hypermobile Ehlers-Danlos syndrome does not represent a severity of symptoms. It actually looks at a specific criteria. So whether you're diagnosed with HSD or HEDS or HEDS actually comes down to a specific diagnostic criteria. And this is the 2017 diagnostic criteria that can be found on the EDS Society or Ehlers-Danlos Society's website. It's a checklist that you can actually fill out with any medical professional or one of us in the team. We can't diagnose, we can look, we can't diagnose, but with one of us in the team to then send you to a medical professional if you are suspected of having or meeting the diagnostic criteria of hypermobile spectrum disorders or HEDS or EDS. So why would you be diagnosed with HSD over EDS or vice versa? So basically we look at on the diagnostic criteria, criterion 2. This takes into considerations things like skin fragility, skin hyperextensibility, so just extra stretchy skin, soft velvety skin, dental crowding, prolapses, atrophic scarring, and it basically looks at the impact that the connective tissue dysfunction caused by collagen dysfunction or protein dysfunction actually impacts you and your body, looking at the impact of those disorders on you. So now the reason I say that HSD and EDS or versus EDS or more specifically HEDS does not represent a severity of symptoms is because someone who does not quite meet the criteria for HEDS can still be left significantly debilitated by symptoms of pain, fatigue, dysautonomia, subluxations, dislocations, and injuries. They can be left just as debilitated without meeting the specific criteria of hypermobile Ehlers-Danlos syndrome, and they are entitled to the same amount of care, support, and obviously deserve to be taken seriously. So the reason I say that is because symptom experience around pain, fatigue, dysautonomia can be and is often very similar in terms of how debilitating it actually is. So I've spoken about hypermobile Ehlers-Danlos syndrome, but there's actually 14 different types of Ehlers-Danlos syndrome, and all excluding the most common type, hypermobile, have a known genetic cause or known protein that is involved in collagen dysfunction and what's actually causing the fragility and friable tissue. So that's fun because hypermobile is the most common type, and yeah, we don't quite have the known cause as to what is going on. So do watch this space. They're doing some amazing research in the area. So the other subtypes or subcategories of EDS include your classical-like vascular, your cardiac vascular and periodontal Ehlers-Danlos syndromes, and each of these subtypes have a major criteria that must be met, one being genetic testing to find the genetic component or at least rule it out, and all of that information again can be found on the amazing Ehlers-Danlos Society's website. So I've spoken about what it is, but how does it actually impact us? And How does it connect to invisible illnesses? How does hypermobility, and I'll call it hypermobility for now on, how does hypermobility influence pain, fatigue, and dysautonomia? So as I've mentioned, hypermobility, it affects all connective tissue, including our muscles, our tendons, our ligaments, our blood vessels, our gut, our all internal organs. Our body is under a constant stress trying to hold us together, basically, because tendons and ligaments don't quite do what they're meant to be doing. So we're prone to injuries, we're prone to dislocations, we're prone to subluxations, mental health challenges with all of this stuff, and all of this increases our allostatic load. So basically the amount of stress that is upon our nervous system, and how our nervous system is interpreting it all as a chronic stress. This is one factor that can lead to pain and fatigue, or an exacerbation in pain and fatigue experience, so allostatic load. Couple this with your stretchy blood vessels. We're prone to blood pooling, we're prone to dizziness, GI symptoms, tachycardia, and troubles maintaining blood flow and blood pressure. All of these are symptoms of dysautonomia, and all further increase our allostatic load, which then worsens symptoms experienced. This can then turn into the vicious cycle of pushing through symptoms because you feel unwell every day and life keeps going. So you just keep going to try to keep up with it. It can turn into a booming and busting cycle, so pushing through, and then you start having bad days, so we cut back on activity. Then all of a sudden you start having good days and you boom on those good days, and then it falls into another bust because you overdid it. It turns into, or it can be perpetuated by fear avoidance and then deconditioning, and then this again perpetuates that vicious cycle of booming and busting, pushing through, or fear avoidance, which then exacerbates and worsens and leads on into more fatigue, more symptoms of dysautonomia, more pain, more injuries, more subluxations, and yeah, this vicious cycle keeps going. So that is a very, very, very brief overview of hypermobile spectrum disorder, hypermobile Ehlers-Danlos syndrome, and other types of Ehlers-Danlos syndrome. I could talk about it for hours, but I'm not going to for the sake of all of you watching this. If you have any questions, please do not hesitate to reach out to the team, and we would be happy to have a chat and see how we can support you. Thank you so much for listening, and take care. Bye.